Them, we thought they are normal people like us.
En 1972, el profesor Anomangu ganó el premio de Lasker, el equivalente americano del premio Nobel, por su contribución a la investigación clínica en el acertado tratamiento quimioterapéutico del linfoma de Burkitt. Ya él no aplica quimioterapia, él utiliza Vanidax.
What you're doing here is that we're using the patient's immune system to deal with the problem. Okay? Burkitt lymphoma, it's viral related. The tumor is as a result of Epstein-Barr virus. And so what we do, we collect the blood and we prepare a vaccine to, sensitize the patient's immune system to be able to take care of the tumor. It's better as opposed to other toxic agents like forms of treating it like chemotherapy, where you may lose your hair, depresses the bone marrow, it causes a lot of toxicity to the body. So in this system, you use your own system to deal with the problem.
I think, honestly, that immunotherapy or the treatment of many diseases can be carried out using immunotherapy. Cancers, HIV, of course, hepatitis B, hepatitis C, many of the tumors that exist without retrovirus, one can treat them. And one will eventually treat all of them, I think, by vaccines, therapeutic vaccines, instead of drugs.
I think that one question that we cannot answer yet with this method is, why do some people respond so well and others not so well? Yeah, I think this has to also be recognized. It is something that he's constantly asking himself and trying to get solutions to it by either modifying his treatment procedure and so forth.
No, there's no doubt that we had some failures. Some of them partly ours, some of them, of course, the patients and whatever. But most of the time we want to look at more the problems as being us, so we work harder, because that's what actually makes us work harder.
VIH positivo significa que uno tiene el virus. VIH negativo significa que uno no lo tiene. Hay dos pruebas para determinar la progresión del VIH y para calibrar la eficacia del tratamiento: el conteo CD4 y la carga viral de la sangre respectivamente. Los CD4 son las células específicas del sistema inmunológico que atacan el VIH. La carga viral es la estimación relativa de la cantidad de virus detectable en la sangre. Una seroconversión es cuando se tuvo la enfermedad y ya no se la tiene. Giselle está estudiando filosofía en la Universidad de Yaoundé. Su salud tomó un giro traumático para peor varios meses después de haber sido diagnosticada positiva.
No hay una solución. Sí. Y cuando estoy, no puedo marchar también. No puedo marchar, no puedo comer, no puedo hacer nada. Es a partir de este momento que me ha poniendo en el CHU, el hospital CHU, y donde he visto el profesor Anomangu, que cuando el profesor verme dice que Giselle, esta enfermedad va a quitar con tu cuerpo, me han dicho. Yo digo que profesor, no es la verdad. Sí, es la verdad. Y mi madre está llorando. Pregunta a los profesores, profesor, Giselle, pienso que Giselle va a morir. El profesor dice que no, ella no puede morir. Ella va a vivir. Hay que esperar.
Alexia es una nueva paciente en la Clínica de la Esperanza y está teniendo su primera consulta con el Dr. Ambe.
My fiancé, the father of my two children, happened to have already been found positive and was receiving treatment here in this clinic. She developed the courage to go ahead and screen for herself since she was already placed in a risky zone. But however, I want her to deliberately respect the hygiene of life, to eat clean food, to have enough water, to get fruit juice, to get vegetables and fruits, and not to be careful about her sexual life so that she doesn't get contaminated again or contaminate some other person.
Okay, hay mucha gente que vivo antes que ha muriendo con esta HIV. Sí, y pienso que voy a morir también, pero no es la realidad porque estaba muy he perdido muchos kilos y mi piel está muy mi piel está muy mal, mi cabello se corta, todo se corta y no puedo marchar, pero antes que el profesor se ha preocupado con mi salud y está muy bien.
It's true that the drug companies did this to try and solve a problem, but I think they chose a solution which provided them with some returns. The work on vaccines will not be quite so profitable.
When somebody comes up with a simple approach solution, it means that he is challenging these institutions and this establishment. Thousands of people are employed because of the AIDS pandemic. Thousands of people feed through the AIDS pandemic because lots of money is spent in the cycle.
At the beginning, the drugs were very expensive. A patient had to have the equivalent to spend about $400 to $600 a month to survive on those drugs. That was the cost they were. And most of our patients can't even get $10 a month to live.
You see, if we make Vanivas and we develop it properly, it takes over antiretroviral drugs. That means we are stepping on the toes of those big, huge companies which make antiretroviral drugs. We're not going to be friends. That's certain, we're not going to be friends. But I think for humanity, it's rather better to do what is right.